Hello, my name is McKenna Carver. This is my comprehensive physical exam. Mr. McLean has granted permission to be recorded on this assessment video. All right, I'm first going to just inspect your skin. I'm going to check for the color, temperature, moisture, texture, any edema, and your skin turgor. Okay, go ahead and look straight at me. Good. Go over here. Good. I'm gonna go ahead and check his hair for the distribution, his color, and the texture, if there's any lesions or masses, or any areas of tenderness. Okay. Any tenderness?
No.
Good. Any recent hair loss?
No more than usual.
Increased dryness?
I'm already pretty dry usually.
Pretty dry. Okay.
No more than usual.
And go ahead and lean your head forward for me. Okay, and lift. All right, and then I'm going to palpate your temporal arteries. Let me know if there's any tenderness, okay? Any tenderness through here?
No.
Wonderful. I am now going to check to see if you have any swelling in your lymph nodes, specifically in the neck, in the front part of your ears and behind, as well as through here, your submandibular, and your posterior cervix and subclavicular, okay? Let me know if there's any tenderness. Anything through here?
No tenderness.
What about underneath?
Mm-mm.
Here. Okay, through here?
No.
Good. What about in your neck? Back in here? Nothing? Okay.
No.
And through your clavicles? Any tenderness? Good. No tenderness, no swelling. Okay, I'm now going to test your cranial nerves 5 and 7. Your cranial nerve 5 is your motor movement, okay? I want you to go ahead and clench your jaws. Wonderful. Tell me if you can feel this.
Yes.
Okay.
Yes.
Down this way. Down your nose. And down your chin.
Yes.
Good. Okay, I'm going to go ahead and inspect cranial nerve 7. Make sure you have facial symmetry. Go ahead and smile. Good. And frown. Pucker your lips. And puff. Good. All right, we're going to move on to ears. I'm just going to look, make sure they're symmetrical. Any ear pain? Good. Okay, tell me if there's any tenderness through here.
No.
What about in the inner portions?
No.
No. Good. Okay. I would then use a otoscope if I had one available to check the auditory canal. All right. We're now going to test your hearing. Okay.
Okay.
I'm going to put this in the center of your forehead. I want you to tell me if you hear one side greater than the other. Okay. Do you hear it equally on both?
Yeah, equally on both.
Equally on both. Okay. Can you hear this? What about this?
Yeah.
Good. And the other side? Can you hear this?
I can hear that.
And what about this?
I can hear that.
Good. One side greater than the other.
No.
Okay. And can you hear this? Good. One side greater than the other.
No, they're the same.
The same? Good. Okay, we're now going to move on to the eyes. I'm going to just inspect the lashes, eyebrows. I'm going to check for the coloring, the sclera of the eyes, any lesions or discharge. Okay, go ahead and look at me. Good. Any vision changes recently?
No.
Good. Any pain? Good. Okay, so we're now going to assess your gross visual acuity. I want you to start by covering your right eye and go ahead and read that sign.
D, C, B, A.
Okay, good. And other eye?
Same line.
Yes, the one you can read.
D,
Small.
C, B, A.
Okay, good. 20/20, go ahead and sit down. All right, we're now going to assess for peripheral and central vision, okay? I want you to go ahead and cover your right eye. And with your left, follow my light. Ready? And good. Good. Go ahead and cover your left eye. Same thing on this side. Good. All right, bear with me. I'm going to shine this light in your eye. I'm just going to check, see if his pupils accommodate and react to light and are equal. One more time.
Okay.
Good. Okay. Lastly, for the eyes, if I had an ophthalmoscope available, I would assess for the red reflex and then the structures of the internal eye. All right, we're going to move on to your nose. I'm going to start by just assessing symmetry, okay? Okay, any nasal drainage that you've noticed recently or any changes? Good, okay. I'm also going to assess the sinuses, your frontal and maxillary. Any tenderness through here? Good. What about through here?
No.
Wonderful. All right, we're going to move on to your mouth. If you'll go ahead and open your mouth for me, I'm going to look inside. Wonderful. Go ahead and go this way. This way. Go ahead and touch your roof of your mouth. Good. Now open wide, stick your tongue out, and say ah. Good. All right, I'm just going to palpate through here. Let me know if there's any tenderness, okay?
Okay.
Tenderness here?
No.
Good. Tenderness through here? Good. Okay, we're now going to move on to the neck. I'm going to palpate the trachea, make sure that it's midline, also palpate the thyroid to check for any swelling. We'll auscultate over the carotid arteries to listen for bruits, as well as palpate. Okay? Go ahead and look straight at me. Good, everything is midline. Any tenderness through here? Good. I'm going to feel your carotid artery. Wonderful. And on this side. Perfect. I'm just going to take a quick listen for any bruits or abnormalities. All right, so now we're going to test the range of motion, okay? So I'm going to go ahead and have you flex your head. Good, now return it back to neutral. We're going to go hyperflexion, so all the way back. Good, and bring it back to neutral. Now we're going to test lateral flexion. So I want you to go this way. Good, and the other direction. And then I want to test rotation, so back and forth. Good. All right, now I'm going to assess your cranial nerve 11 to check for symmetry. Okay. Go ahead and push up against my hands. And down. One more time. Good. So now we're going to be doing the posterior chest. First, I would start by inspecting the color, temperature. I would check the moisture, if there are any type of lesions, discolorations of the skin. I would then assess for any type of respiratory distress, such as labored breathing, using accessory muscles, being in a tripod position, nasal flaring, or any type of tachypnea, dyspnea, or cyanosis. And he looks great, doesn't show to be any signs of distress. Respiratory rate is even and non-labored. All right, so then I would inspect for obvious deformities, check the symmetry and the even expansion of the chest. So go ahead and take a deep breath for me. Wonderful. Okay. I'm going to now assess any tactile firmitis. Okay.
99. 99. 99. 99. 99. 99.
Okay, I'm now going to percuss over your posterior lungs, okay? I want you to take your arms, fold them over your chest. Good. And slightly lean forward. Kind of round your back. Good. Okay. And this side. All right, now I'm going to just take a listen to your lungs, okay?
Okay.
Deep breath in. Last time. And again. Okay, I'm now going to auscultate over the anterior chest. And again, normally with a patient, I would inspect the chest, look for symmetry in the color, look for any lesions. I would check skin turgor, but for the purpose of this video, I'm going to have him keep his shirt on. All right, big deep breaths again. Okay. Good. Good. Okay, we're again going to test for any tactile firmitis throughout the anterior chest. So same thing, we're going to say 99. I'm going to place this part of my hand up against your chest, okay?
99. 99. 99. 99.
Okay, so then I would move on to the heart. I'm going to assess the five parts. So main thing, we're going to assess for the aortic, pulmonic, Erb's point, mitral, and tricuspid. Okay, I'm going to take a listen. Good. I'm then going to find the point of maximum impulse, and I'm going to listen for a full minute. Good. S1 and S2 sounds are audible. No thrills or murmurs, and heart rate of 62. So now I'm going to inspect the patient for any heaves or lifts, and then I'm going to palpate over the auscultation points to check for any thrills. No thrills, heaves, or lifts. I'm then going to auscultate in the 5 points again while the patient's supine. Good. I'm then going to have the patient lift his head in a 35 to 40 degree angle. I'm going to assess for any JVD, jugular vein distension. Go ahead and lift your head. Good. I'd be checking right here. And he has no jugular vein distension. Okay, so we're now moving on to the abdomen. Typically, again, I would have the patient take off their shirt. I would be checking for color, symmetry, skin turgor, if there's any lesions or swelling, especially if someone had ascites or something like that. Okay, so I'm going to auscultate over the 4 quadrants. I'm first going to palpate your stomach, okay? Let me know if there's any tenderness. Good. Good. Bath sounds are active in all 4 quadrants. Okay, I'm now going to percuss all 4 quadrants. I'm checking for tympany, dullness, or any flatness. And then I'm also going to palpate the liver and the spleen. Any tenderness to here? Good. And what about over here? No tenderness? Good. What about through here? Any tenderness?
No.
Good. Okay, so now I'm going to assess for any CVA tenderness. I'm going to have you set up. Go ahead and turn around and face your head that way. Okay, so I'm just going to percuss. Let me know if there's any tenderness or discomfort.
Okay.
Okay. Okay, there. Good. And here.
No.
Good. Okay, so now we're going to move on to the upper extremities. I'm going to inspect and palpate the joints of his hands. I'm going to check and see if there's any swelling, tenderness, any nodules, crepitus, or deformities. Okay, go ahead and hold out your hands for me. Any changes in tenderness, swelling of the joints that you've noticed? Good. Good. Go ahead and bend them. Good. A little crepitus. Okay, and you can flip them back over. All right, go ahead and hold out your hands. I'm going to check for capillary refills. Good. And this hand. Okay, go ahead and lay your wrist down. Good, pulses are equal, +2 bilaterally. Okay, we're gonna assess the range of motion of your fingers. Go ahead and hold out your hands. I want you to make a fist. Okay, so flexion, extension, good, hyperextension, adduction, abduction, okay, pronation, supination, and go ahead and good. Okay, we're gonna assess your hand grips. Go ahead and squeeze my fingers as hard as you can. Awesome, and release, good. So then we're gonna move to the wrist. I'm gonna notice if there's any crepitus, changes in skin such as discoloration, as well as skin turgor. Okay, good. No changes, go ahead and move them for me. Okay, a little crepitus, good. All right, same thing, so we're gonna okay, so we're gonna assess the range of motion of the wrist. Go ahead and put them out for me. We're gonna do flexion, extension, hyperextension, good. Now I want you to show me your rotation. Good. Okay, so now I'm going to assess the elbows. Again, I'm gonna have you hold your arms out. I'm gonna inspect it, check for color, turgor. I'm gonna check for any discoloration of the skin. Good. All right. So now I'm going to have you bend, flexion, extension, hyperextension. Good. Any pain with that? Good. All right, we're gonna assess your bicep strength. So go ahead and bring your left arm up. Oh, sorry. Bent, okay? So now I'm going to try and pull your arm down with some resistance, okay? Make resistance. Good, and this side, same thing. Up. And pull, 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 pull. Good. So now we're gonna assess the range of motion of your shoulders. Okay, so go ahead and sit on the edge. Right there is good. Okay. I'm gonna inspect his shoulders for color, any tenderness, any warmth. You look good, okay? So we're gonna start with flexion, good, extension, hyperextension, good. Go ahead and bring it back to neutral, okay? Internal rotation, external rotation. Now we're gonna go to adduction, abduction, and circumduction. Good. We're gonna go ahead and assess your shoulder strength. Go ahead and put your arms out. Okay? I'm going to press down. I want you to create resistance, okay? Good. Good, now bring them forward. Same thing, don't let me push down. Good. All right, just tell me if you can feel this, okay? I'm just gonna assess and see if he has any sensation of the upper extremities. Feel that?
Yes.
And can you feel that?
Yes.
What about this?
Yes.
Okay, good. Okay, we're gonna assess your opposition. So go ahead and scoot back a little. And I want you to touch my fingers, okay? Good. Here. 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 Good. And other side. Good. Okay, so we're now going to move on to the lower extremities. I'm going to start by assessing the feet, checking for any discolorations, tenderness, crepitus, deformities, turgor. Okay, any tenderness? Good. And this side, any tenderness?
No.
Good. No swelling bilaterally. No edema. So then I'm going to test your range of motion. So go ahead and flex. Now we're going to do neutral extension. Now hyperextension. Good. Okay. Now go ahead and we're going to do abduction. So go out and then adduction. We're going to go in. Good. Okay. I'm going to assess the capillary refills. Make sure. Good. Capillary refill is less than 3 seconds bilaterally. Okay, then I'm going to assess pulses. So I'm going to start by doing his dorsalis pulses and then posteriotibial pulses. Okay. Here. Good. And I'm going to go back here, feel pulses. Good. Again, I'm going to look at all of lower the extremities. Absolutely no edema, no warmth, no redness, no changes in skin. Now I'm going to move on to the ankles. Again, no swelling, no changes in skin, discoloration, skin turgors, good. We're going to go ahead and test the range of motion. So for this, I'm going to have you go ahead and do flexion, dorsalis flexion, extension. Now we're going to go to inversion, eversion, and rotation. Go ahead and rotate. Good. Any pain with that?
No.
Okay. All right, I'm going to test your strength. So I'm going to put my hands here. Okay, push. Good. And same thing, I'm going to put him here. And I want you to push. Ready? Go. Good. Okay, so I'm not going to have you go ahead and sit up. Normally we'd probably have a patient lay down for this, but for the video and being able to see, I went ahead and had him sit up. So I'm going to look at the knees. I'm going to check again, color, any wounds, crepitus, tenderness. Do you experience any tenderness? Okay, good. We're going to go ahead and assess the strength and resistance, okay? So I'm going to have you bring this leg up first, okay? And don't let me push down. Good. Same thing with this leg. Go up. Don't let me push down. Good. Bring it straight out, and back down. Same thing with this one, straight out and back down. Any pain with that? Good. Okay, I'm also gonna check your range of motion throughout your hips, okay? So go ahead and bring out your left leg. We're gonna go out and back in. Good, and lower your leg. Same thing with this one. Out and back in. Any pain with that? Good. Okay, I'm going to go ahead and have you stand up. So when we're assessing the hips, I'm going to palpate for any tenderness. Any tenderness?
No.
Good. I would also visualize the skin, check for any changes, any redness, any warmth, as well as the turgor. So now we're going to move on to the range of motion. So it's kind of the same thing. Flexion, extension, hyperextension.
Okay.
Okay, go ahead and do that with this leg. Flexion, extension, hyperextension. Same thing with this other leg. Flexion, extension, hyperextension. Good. Okay. Now we're going to do abduction, adduction, abduction, adduction. Bring it to the midline. Good. And then we're gonna do internal and external rotations. So internal, external, good. Internal, external, good. Okay, so now I'm going to inspect the spine. I would start by palpating, checking for any tenderness, swelling, or discomforts. I would also have the patient take this off and look for any changes, any wounds, sores, swelling, any tenderness.
No.
Okay. Good. We're going to assess your range of motion. So go ahead and flex. Good. Now extension, hyperextension. Good. Okay. Now I want to just look at your curvature of your spine. We're going to check and make sure that everything is in line. So go ahead. I want you to just lean forward and reach for your toes. Good. Okay. So we'll start at the top and work our way down. Just checking to make sure the spine is nice and aligned. Good, and no scoliosis. Go ahead and lean back up. All right, so we're gonna now test balance. So I want you to go ahead and bring your hands over your chest, okay? We're gonna count to 30.
Okay. 1.
Good, okay, now relax. We're gonna do the same test now with your eyes closed, okay? So whenever you're ready, bring your arms back up and eyes closed. Good, okay? And he is negative on the Romberg test. He did very well. And then we're gonna assess your gait. So I'm gonna have you walk, okay? Ambulate and go back. Good, he's got a normal gait, no deficits. There. Okay, so now I'm gonna have you hop in place. Okay, so we'll start with the left foot, hop, and the right foot. Good.